Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, March 23rd, giving you the update from Albany Med. All right, Fred, it's Blue Shirt Tuesday.
Blue shirt? Absolutely. We talked from the closet.
Let's pop up the first screen here. Capital Region, 8 counties. We currently have 106 in the hospital who have COVID. That number was as high as 553. Fred, on the regional call today, I think the word that was being used is we're hovering. We're hovering in that same number.
We are, Dennis. Remember the regional call is a little bit larger group. We're at 124 last week. We're at 121. So we're sort of status quo. The number of admissions is equal to the number of discharges.
When you look at the prevalence in the community who test positive, that's also been staying 2% or just under 2%
That's
now
right.
for a couple weeks.
For a couple weeks now, since the beginning of March, really.
Let's look at the next graph. Fred, you referenced this. This is admissions and discharges to the hospital. Relatively balanced. The good part here, though, is that the number coming in is small. So one or two per day on most days.
We haven't had double digits in more than 3 weeks.
That's right. And then finally, the morning census here at the medical center. We currently sit at 23. The breakdown is 12 on the floor, 11 in the ICU, 6 on ventilators. Fred, I know you and I both walk around the hospital. We walk through the ICU today. They're still there taking care of these patients and other non-COVID patients, but doing a great job.
They are. They're doing a fantastic job, Dennis.
Fred, let's talk about the efforts of the Capital Region Vaccine Network, the 8 counties that we talk about. Let me look at my card here, give you the most current numbers. So 337,000 people have received at least the first dose of vaccine, which is remarkable. That's 31% of the eligible population. Those that have completed the vaccine series, which includes those who've gotten 2 shots in a 2-shot series, or in some cases just the 1, 166,000, so that's 15%. Fred, how have we done in the last week?
In the last week, Dennis, 47,000 people have received vaccine doses.
In just the Capital Region?
Just the Capital Region. Just a phenomenal number. Absolutely.
Fred, any news on AstraZeneca? We've been hearing that they're starting to look at that.
So AstraZeneca put out a press release yesterday on the efficacy of their vaccine.
Right.
And it's about 74% effective in preventing COVID infections. Now, it's interesting. There's a little more news today about that, and maybe not all the data has been presented. We'll hear more about that in the coming days and weeks. But first blush, it looks very effective.
That's great news. The other good news yesterday is the criteria for those who are eligible for the vaccine has changed again. Now 50 and above, so the criteria, the age limit came down. Fred, there's so many vaccinators now in the Capital Region. You have, obviously, the county, local health departments that are doing a remarkable job. We have 3 different, what they call large mass vaccination sites, one in Queensbury and 2 in Albany, one out at University of Albany and one on Washington Ave. Obviously, pharmacies are in the business. We're seeing physicians' offices getting the vaccine. It's really great news. And capitalregionvax.org still is the best site to go for all that information.
That's right. For the information on where to get your vaccine, absolutely the place to go and look.
So if we're getting 50,000 a week, then obviously we can hope that in the next month or 2 we'll be picking up a couple more 100,000 in the region.
That's right, Dennis.
That's wonderful. Exciting news on campus was Match Day the other day. So for those who don't know what Match Day is the day when all throughout the country, at the exact same moment, everybody who is in their 4th year of medical school learns where they're going in the next year, and they're learning what specialty they're going to go into. They've applied for certain specialties, and they find out whether or not they are able to match in that specialty. And on this campus, we want to congratulate the graduating class this year, 124 students in the match. Congratulations to Dr. Verdile and the deanery for that group. It was an exciting day in this campus. Just to give you a breakdown of our graduating students and what they're going into. The top 5 programs of where our students are going in sort of rank order are internal medicine, which is a feeder system for not only primary care but cardiology and GI.
All the subspecialties.
Pediatrics, anesthesiology, obstetrics and gynecology, general surgery, emergency medicine, and orthopedics. And Fred, I think it's fair to say that if there's a medical specialty out there, we had students who went into it, which is great.
That's right, Dennis.
46% of our graduating class is going to go into a specialty which is involved in primary care, which is great news. And 46 of our students, or 37%, are going to stay in New York State. And Fred, I think we've heard this statistic before. In the capital region, over half of all the physicians who practice either went to medical school here or did training here.
That's right.
So it's really a feeder system, not only for Albany Medical Center, but the whole capital region.
If you think about it from the other perspective, Dennis, absent the medical college here, the physician population of this region probably would be very different.
For sure. So I talked about the students from Albany Med going out. Fred, they also come into programs here.
That's right. We have a large number of programs here. So we had 22 programs match first-year residents, 116 first-year residents. And those programs all did tremendously as well, attracting students from notable medical schools like University of Rochester, Case Western, UMass, Boston University,
right.
Penn State. So really high-quality group of medical students coming here to do their next layer of training as residents.
Some of those residents come here for 3 years. Some come from as long as 5 or 6 years.
7 years.
7
even.
years in
Yes,
some cases.
Some of the surgical specialties.
So to those who will be coming in, we welcome them here as well.
And Dennis, you know, I said 116 first-year
Right.
residents. We have close to 470 trainees here at the medical center, because obviously
Right.
that's just the first year, but they're second, third, fourth, all the way to seventh-year residents.
We talk about that, right? So we're not a hospital on this campus. We're an academic medical center. We have clinical care, we have education, we have research. The education component includes not only training medical students, nurse anesthetists, bioethicists, people who go into the basic sciences and become PhDs, but residents. We
That's
train
right.
them. That's
That's
part of
right.
our educational mission.
PAs as well, Dennis.
PAs as well. Let's not forget them, for sure. Okay, Fred, we had an Eye Care Award winner yesterday at CCLM. So that's Nick Giorgio, who is the supervisor of the call center. And it's always exciting to announce the winner of the Eye Care Award. He was a very worthy winner of that award.
He really was, Dennis. And in the nomination documents, you know, the things that were said about him, one of the things they said was if a call comes in and something needed to happen pretty quickly,
Right.
he himself would get up from his desk and go and move that bed or do whatever it was that needed to happen promptly. I mean, that really shows a lot of character for Nick. It's just
For
tremendous.
sure. Yeah, a true servant leader.
Absolutely.
But he also took the opportunity when he received his award to actually be very gracious and talk about other people.
Yeah, that's right. He basically said this award is really deserved by everyone in this room and everyone in the institution.
Yeah, well, obviously
Yeah.
he deserved it. So congratulations to Nick.
Congratulations.
Fred, I think that's our update for this week. We do have a couple exciting, I should say for today, we have a couple exciting things to mention on Thursday. Projects that have been out there being worked on that we're going to now start talking about more in a public way. Really that speaks to the broader vision and mission of the medical center.
And you know, Dennis, those have been quietly going along even with
Right.
COVID happening around
Right.
us. So it's going to be very interesting to talk about those on Thursday.
All right, we'll be back then in 2 days. We'll see you then. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Thursday.